Is it safe to delay your period? Welcome to the Fact Check channel. If you haven't subscribed, please do. On this topic, we will start by defining the term period. Period is a release of blood from a girl's uterus, out through her vagina. It is a sign that she is getting close to the end of puberty. What causes a period? A period happens because of changes in hormones in the body. Hormones are chemical messengers. The ovaries release the female hormones estrogen and progesterone. These hormones cause the lining of the uterus, or womb, to build up. The built-up lining is ready for a fertilized egg to attach to and start developing. If there is no fertilized egg, the lining breaks down and bleeds. Then the same process happens all over again. It usually takes about a month for the lining to build up, then break down. That is why most girls and women get their periods around once a month. So what is period delay? A woman's menstrual cycle is regulated by a complex interaction of hormones that originate from the brain, ovaries, and uterus. There are two hormones that regulate a woman's menstrual cycle: estrogen and progesterone. So period delay is a technique used by many women to postpone their menstrual cycle. This is achieved by taking synthetic hormones such as progesterone and/or estrogen. These hormones work by safely stopping ovulation, as well as thickening the mucus within the cervix to help prevent sperm from entering. As a result, your body will not release the eggs from your ovaries. For years, women have been using norethisterone to temporarily pause their menstrual cycle. Maybe you have a beach holiday coming up, or you're scheduled to give a big presentation at work and you don't want bad cramps to interrupt you. Taking period delay tablets can prevent your period from beginning during an inconvenient time, making it easier than ever for women to pause their cycle. Delaying your period is as normal as having them. With proper consultation and correct guidance, it is absolutely safe to delay or skip periods. But only one thing needs to be kept in mind. That is, there can be several side effects of period delaying pills. Most periods delay pills work on the same principle. To better understand how these pills work, let us use one of the periods delay pill product, norethisterone. Exactly what is norethisterone? Norethisterone is a synthetic version of progesterone, a hormonal drug that is commonly used to postpone menstruation. When it comes to delaying your period with pills, many people reach for norethisterone. But what is period delay and how quickly does norethisterone work? Norethisterone is an example of a progestogen. It works by artificially keeping your progestogen levels up. Norethisterone tablets are a prescription treatment, used to delay your next period for up to 17 days. They are in the group of medicines called progestogens, which is similar to the natural female hormone progesterone. This helps to regulate the menstrual cycle and can prevent ovulation. This allows women to have control and flexibility over their periods without using contraception. At this point, it's also important to note that norethisterone is not a contraceptive. Norethisterone has features of mimicking the effects of the natural female hormone progesterone. Progesterone is a female hormone in the ovaries responsible for the menstrual cycles and maintaining the pregnancy in a woman. Abnormal progesterone levels can ruin the menstrual cycle. How quickly does norethisterone work? Norethisterone is taken 3 to 4 days before your period. They are normally taken 3 times daily, starting from 3 days before the expected onset of a period. They can be taken for up to 17 days. A good way to remember to take them is to take them with meals, though this is not required. Once you stop taking the medication, your period will return in 2 to 3 days. It is important to take norethisterone exactly as prescribed by your doctor to achieve the best results. Are there any side effects of taking period-delaying pills? Anything taken in moderation can help you, whereas if taken in excess, it can lead to some serious side effects. The constant use of any medication can have dire repercussions, especially if you take it without consulting a doctor. While period-delaying pills are not harmful as such, some women can experience certain side effects. It is important that you keep in mind the consequences of taking period-delaying pills to avoid any complications. The main major risk of delaying a period is breakthrough bleeding. This is the bleeding or spotting either during menstrual periods or pregnancy. It doesn't necessarily mean that people who have missed several periods will have this spotting or bleeding. But if this type of bleeding occurs frequently, find an alternative after discussing it with the doctor. Some other side effects to look out for are mentioned below. Development of rashes throughout the body, feeling of dizziness, headaches, unable to retain fluid, imbalance of hormonal levels, problem of jaundice, weight gain, feeling of bloating, breasts become tender, development of acne, feeling of nausea, disturbance of mood, reduced sex drive, elevated blood pressure, episodes of migraine, asthma, heavier bleeding than usual. Delaying periods regularly can change the natural menstrual cycle of the body, which is not considered to be normal. This gives rise to other problems such as irregular periods. Before popping a period delay tablet, consider the following dash. Consuming progesterone tablets regularly can result in irregular periods. Unless it is absolutely necessary, avoid using these pills at all. 5 types of birth control that stop periods. 1. Birth control pills. Approximately 25% trusted source of females in the United States who use contraception report using birth control pills as their method of choice. Pills that suppress periods are the same as regular birth control pills. However, birth control pills usually involve taking this medication for 21 days and then a further 7 days of taking a placebo. If a person takes contraceptive pills to stop periods, they will usually take them consecutively with no placebo drug. They may still experience light spotting or breakthrough bleeding. When taking a break from hormonal birth control, a person may experience withdrawal bleeding, which may resemble a period. 2. Birth control ring. A person places a contraceptive ring inside their vagina that releases hormones into the body to prevent ovulation. When using this as contraception, users remove the ring after 3 weeks to have their period. However, a person can opt to leave it in if they wish to skip their period. 3. Intrauterine device. This method involves a health professional inserting a T-shaped device into the uterus. It releases a small amount of daily progestin. The device usually stays in place for 3 to 6 years, but a health professional can remove it at any time. This device will stop periods altogether for some people, but it may reduce or lighten periods for others. 4. Depo-Provera injections. The Depo-Provera, DMPA, injection is available in the US and requires a shot every 3 weeks. It protects against pregnancy and can result in lighter or no menstrual periods. However, it may also result in irregular periods. 5. Patch. A person can wear a birth control patch, which they need to change weekly. They can wear it on the lower abdomen, buttocks, or upper body. The patch releases hormones directly into a person's bloodstream. Typically, a person would remove the patch for the 4th week to allow for a menstrual period. However, if a person keeps the patch on for this 4th week, it can delay or stop periods altogether. Pros and cons of birth control that stops periods. There are advantages and disadvantages of birth control that stop menstrual periods. Advantages include reduced risk of developing anemia. Trusted source, ovarian cysts, and ovarian and uterine cancer. No monthly cramping or premenstrual syndrome. Clearer skin. Lower costs of feminine hygiene products. Disadvantages include the possibility of breakthrough bleeding. Types of birth control that do not stop periods. There are many forms of birth control that do not necessarily stop a person's period, depending on how people take them. They include 1. Birth control implant. This is a matchstick-sized rod that doctors implant into the arm to release hormones into the body and prevent pregnancy. 2. Hormonal and non-hormonal IUDs. These are long-term and reversible birth control devices that doctors insert into the uterus to prevent pregnancy. They include copper IUDs and hormonal IUDs. 3. Birth control shot. This shot will stop periods altogether for some people and lighten periods for others. 4. Birth control ring. This is a small, flexible ring that a person inserts into their vagina to prevent pregnancy by releasing hormones into the body. 5. Birth control patch. This is a patch worn on certain parts of the body that releases hormones into the skin to prevent pregnancy. 6. Certain kinds of birth control pills. Birth control pills are either COCs or progestin-only pills, POPs. COCs release estrogen and progestin into the body, but POPs only release progestin. 7. Diaphragm. This is a bendable cup that a person inserts into their vagina to cover the cervix and prevent pregnancy. 8. Birth control sponge. This is a small sponge that contains spermicide, which destroys sperm. 9. Fertility awareness methods. This method involves tracking ovulation to prevent pregnancy. In conclusion, one of the biggest issues many experience with skipping or delaying their period is breakthrough bleeding. Other side effects include but aren't limited to nausea, breast tenderness, mood fluctuations, and lower sex drive. Unless it's very necessary, don't stop your periods.